My name is Destiny Smith, and I am a nurse in a critical care unit in Knoxville, Tennessee. I am going to be speaking towards what being a BSN prepared nurse looks like past getting my bachelor's and what it looks like in my nursing career. So, 3 ways that I will integrate principles of being a bachelor's prepared nurse in my nursing career is by providing patient-centered care, culturally competent care, and evidence-based care. And the first principle that I spoke to is providing patient-centered care. As a nurse, our care needs to be centered on the patient. You don't simply think about your day and think of it as a to-do list, but it needs to be centered around providing the best care possible towards the patient. They are an individual and a human being, and we know this. But integrating it into my nursing care is something that I try to do now and will plan to do every day throughout my nursing practice. And this looks like, for example, I don't simply turn my patients to prevent a pressure ulcer to save the hospital money. Yes, that is something that it does do, but also my thought process is on the patient. Turning them prevents them from getting something that is harming them, that is harmful, is painful, could cause them an infection or even a longer hospital stay. It is detrimental to them. So by turning them, it keeps them comfortable, keeps them healthy and safe. Next, the next principle that I spoke towards is providing culturally competent care. We live in the United States, in Knoxville, Tennessee. There are many different cultures and individuals, and each of those individuals learn and speak and understand in different ways. Being a nurse that is culturally competent is understanding that every patient is going to be different. Taking a second to speak with your patient to understand what they need culturally, what is best fit for them, is something that we can do every day. This might look like when I sit down to educate my patient, understanding that they might need materials that are in a different language. They might need materials that are in Spanish. They might need a translator to make sure that they get the full understanding of what is going on. And doing that does not do anything. Being culturally competent just simply helps the patient. And then taking that information we learn about our patient and passing it on every day, passing it on to the next shift, making sure that they get the culturally competent care that they deserve. And lastly, but not any least important, is providing evidence-based practice and evidence-based care. Not simply doing the same things because that's the way we've always done it, but to understand the science behind it, understanding how it affects our patients and how they get the best care from it. And this looks like not simply going to work every day and not taking a second to think about, why do I turn my patients? What is the best evidence-based practice? What is out there? And staying informed at what the best practice is, and then bringing it to the forefront of our coworkers and our peers and our work to make sure that we're all on the same practice of providing the best evidence-based care. And we all know that nurses don't stop with education. Nurses may finish a degree, but lifelong education is something that is just very important in this profession. For me, I will continue lifelong learning, first of all, by getting my CCRN. I work in a critical care unit, and the CCRN is simply a certification in the critical care. It looks like working in a critical care unit for 2 years and then taking an exam that is focused on providing the care to those critical patients. And the second is by getting continuing education units, not just what is expected by your state, but also above and beyond, and making myself available to the extra education classes that are available by my work. We do education online, and there are the education classes that are expected to be taken every year that you have to take, but then there are always abundant and many other classes that can be taken also. And throughout this education process, being a servant leader has been exponentially expected and spoke about, and I'm so thankful to have that education. But being a servant leader doesn't simply look the same to everybody. Nurses come into contact with patients, we come into contact with their families, we come into contact with many different professionals, and we also are a person in a community, in a personal life. And being a servant leader isn't something that you can turn on and turn off, and it looks different to everybody. Being a servant leader to a patient may look like just the nurse going above and beyond, and that is going above and beyond what is expected, not simply passing the meds, but maybe taking a few minutes to sit down and have a conversation with the patient that has nothing to do with their care or their medications or the plan for the day, but is a conversation that's makes them feel like a human again, that may lead to a smile or a laugh, and just makes them feel past being a patient but a human. Towards their family members, being a servant leader looks like taking care of them also. We know that we don't just simply take care of the patients, but their family members also. They're not just a person that's standing in the room when you come in to help the patient or to provide some sort of nursing care. And I think we forget this. I think that being a servant leader may look towards the family members as being willing to sit down and talk to them about what's going on. Of course, making sure it's okay with the patient, but explaining the plan of care and what is going on and what is the process of nursing in the hospital and what they can do to be there for their family, for their loved ones. I also think it's just willing to stop and ask them, can I get you something to drink? Can I get you some food? Encouraging them that we are taking the best care of their loved one, and encouraging them to take care of themselves, to maybe go home and take a shower, to get some rest. And for our patients and our peers and our coworkers, being a servant leader looks like being available to lend the helping hand. Often, we all know that in our shift we can get behind, we can need extra help, and I think being a servant leader looks like offering that help when you see another coworker struggling. It looks like not only offering the help, but going a step forward, doing the help, providing what they need, and doing it with a smile and a positive just overall demeanor. And in our community, in our personal life, being a servant leader for me looks like providing what I need for my community, taking a step further in my church and to understand what they need and to provide it. So that might look like me volunteering at the local soup kitchen and being a smiling face there. And lastly, being a nurse is, of course, not only treating the body physically, but also the mind spiritually. And that is something that has been also spoken to in this BSN program. And I think that we as nurses just need to remember that spirituality is a big part of being a nurse. Spirituality for patients is something that they all have. And we as nurses just need to stop, understand what they need, the patient needs, and then provide that. If it looks like changing meal times, if it looks like maybe making ourselves a little uncomfortable, and being willing to hold their hand and pray with them at times, then that is speaking towards the patient and providing the care that they need. Spirituality isn't something that is separate in health, but is something that is a whole, and we need to treat that just as we treat pain and discomfort and physical symptoms. And nurses need to, and the BSN program has maintained that and taught us how to provide spiritual, holistic care fully and spiritually.